And there will be a lot of ways that people can help. Thank you.
A comment first. My health insurance for next year is going down $25, and that is because of the Obamacare. So,
wow.
But a question. I thought early voting was going fairly smoothly, and my son and I both early voted, and he said, "Mom, they're keeping track of your ballots." And I said, "How are they doing that?" He said, "Didn't they mark your ballot as to how many people had voted in that precinct?" And I do remember them putting a number on my ballot. So that to me speaks that it's not a very private process anymore if you're early. I don't know if that's just early voting, or I think it is.
I'm not sure that I can speak to that. I don't know that that indicates anything nefarious, but is probably just one of the things to understand about early voting and absentee voting that's different than regular voting when you come out on election day. When you come out on election day, they have those papers that have all of everybody in that precinct. They have their names and addresses and a sample signature, and you show up to vote, and you sign and you go and vote. For the other kinds of votings, they don't necessarily have those materials available all the time, or they keep track of ballots in a different way, but they do have to keep track of ballots. I would not assume that that indicates something nefarious, but I don't keep up with that level of detail. Yes.
In the national debate, there's one point that I think has been very, very poorly explained, and that has to do with cost shifting. And I wonder if you might be willing to comment briefly on exactly how this works here in Champaign-Urbana. I do know if you land in Carle Hospital, the hospital room is thousands of dollars a day, or that's true in Covina too. But the cost shifting affects that, and I wonder if you would speak to that point and why you think that this has not been explained. Most people don't really understand it.
Yeah, or people may understand it but not know that that's what it's called. Cost shifting, it comes in many different shapes and sizes, but one of the things that happens is that if somebody is uninsured and they need to go to the emergency room at either of the hospitals, and they go and they get the health care that they need, but they cannot pay for it, and our hospitals have very good financial assistance programs, so they can get a 100% discount if they qualify, but it still costs resources and money to provide that care. And so what happens is that those costs, those real costs, get shifted onto other parties and in other ways, and it drives up the cost of health care. So, because all health care has to be reimbursed one way or another. And so prior to health reform and prior to its full implementation, for example, one of the things that would happen is that the insurance premiums for insured individuals would go up, because the insurance company has to negotiate with the healthcare provider. We're going to bring you X number of patients and we only want to pay this much for services. But the hospital has all this other unpaid stuff that they need to try to make up for somewhere, and so they bargain with the insurance companies to set a better price that allows them to cover some of those other costs. So that's one example of cost shifting. Another example is when you get a health insurance plan, and let's say that that you have an HMO and it had $20 copays when you would go to an outpatient visit to see your doctor. And then the next year when the plan renews, they say it's going to be a $20 copay plus a 20% cost. 20% cost of the total cost of your visit. Now all of a sudden you have to pay more money out of pocket. That's cost shifting, because the insurance company is saying, we're going to pay for less of your care, and you're now going to pay for more of your care. Now you not only have this $20 copay, but you have this 20% copay. So that's a form of cost shifting. Another form of cost shifting is when I go to renew our health insurance plan, and talk to the insurance company and they say, you know, you offer a very rich plan. I hate that. I beg any insurance person to never tell me to my face that good quality insurance is rich and that it's a rich plan. It's just insurance how it ought to be, where benefits are provided. But we offer what they call a very rich plan, and they say that we can hold down our costs as an employer if we have a different kind of plan that leaves the employees with more out-of-pocket expenses. And then as an employer, I pay lower premiums, but that's because I've just cost-shifted them onto my employees. That's another example of cost-shifting. I don't do that, by the way. But so there's many different examples, you know. So we've had this very inefficient way of paying for health care. We have the highest cost of any industrialized nation and fewer people getting the care that they need when they need it. So we need to change that, and health reform aims to do that. And then I thought...
Ditto on the thanks. Speaking of things that aren't well explained, it's just amazing to me that you know, cuts to the overpayment on Medicare Advantage can be called a cut to Medicare. But another thing that I just heard recently, maybe you can confirm it, is that contrary to what you hear about doctors and underpayments on, I believe it's on the Medicare side, that actually the ACA includes an increase for GPA, you know, the primary care physicians is in the works. So that you don't hear that anywhere. But the other thing is SimpleRx. I'd like just a few words on SimpleRx, because that's a part of the ACA that I hadn't heard about at all, and I guess in 20 or 27 states, nonprofit healthcare business concerns, co-ops are going ahead, or at least trying to.
Thank you. I'll talk about the first thing first, which was about the increased payments. It's actually Medicaid will increase. Part of the Medicaid expansion is to pay more for primary care visits. And that's to incentivize healthcare providers to accept Medicaid and to also pay them for encouraging primary and preventive care. And that's just something that needed to be done. And remember, Illinois has actually one of the worst rates in the nation of Medicaid payments to physicians. We rank very, very low. And so with national health reform, with that Medicaid expansion, the federal government is going to pay 100%, and their Medicaid payments for primary care are going to be closer to the Medicare rate. So that's a good thing. In terms of the second thing that you talked about, I didn't mention this, but one of the other things that health reform has made possible, that the National Health Reform Law has made